From the Soapbox is the official podcast for the American Animal Hospital Association's digital newsroom, Trends. Here, we take inspiration from the familiar soap notes, but instead of looking at the condition of a patient, we're diagnosing and discussing the state of the veterinary industry. We'll chat about the challenges, trends, and innovations shaping the veterinary world with voices from across the community. I'm your host, Dr. Emily Singler. Thanks for listening. Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Marie Holowaychuk, a board-certified emergency and critical care veterinarian, veterinary well-being advocate, and founder of Reviving Veterinary Medicine. You've probably seen her work before, as she's created programs that help prevent burnout and build resilience in veterinary professionals, and she's been a passionate advocate for improving mental health and well-being through her podcast, blog, and social media accounts. Today we talked about her new book, A Compassionate Calling, What It Really Means to Be a Veterinarian. It was truly a massive undertaking because she covered so many topics, from her own journey to the demands of veterinary education, toxicity in veterinary practices, dealing with difficult clients, mental health within our profession, and her outlook for the future of veterinary medicine. There was so much to talk to her about, so we just kind of dug right in this episode so that I could ask her what inspired her to write the book and how she hopes both veterinary professionals and the general public will use it to be informed, supported, and inspired. I definitely learned a lot from this conversation. So now, without further ado, from the Soapbox, Dr. Marie Holowaychuk. Dr. Marie Holowaychuk, thank you so much for joining me here on the podcast. I'm really excited to have you on.
Oh, I'm so glad to be here too, Emily. Thanks for having me.
Yes, I'm very excited. I've been sort of following along on your journey. You are now a published book author. Your book, A Compassionate Calling, What It Really Means to Be a Veterinarian, has just been published within the past few weeks. And I'm so excited to see it. I've gotten my copy and excited for us to kind of delve into it and learn more about it today and what you hope it will do out in the world and who it's for and all of those good things. But I'd love to start by well, first of all, congratulations. Very excited for you.
Thank you.
And then I would love to um, have you share kind of how you decided to write this book and on this topic and what that journey was like for you.
Yeah, absolutely. Well, as you know, this journey started many years ago. I really never thought I would write a book that pet owners could read. I've always been writing articles and research and textbooks for veterinary professionals. And I guess the idea really started forming decades ago. I grew up in veterinary medicine, essentially. Both my parents are vets. My mom had a companion animal practice in the town where I grew up. And so from a very young age, I would spend many, many hours and weekends in the practice. And I remember sitting in the office and they had this big bookshelf of books there, mostly textbooks, but they had some James Herriot's books. And I remember looking at them from a young age, even just looking at the cover and, seeing these men with cows and horses and these funny pictures and asking my mom, what are these books? And she said, well, those are books about veterinary medicine, about being a veterinarian. And I thought, like that's not what I see as veterinarians in my life. And, came to understand that, James Herriot, of course, had written these books decades before when veterinary medicine looked quite different. And fast forward to just a few years ago, when I was just starting to immerse myself in the veterinary wellness space, and I came across one of the earlier studies by the Merck Animal Health Veterinary Wellbeing Group, where they had found that less than half of veterinarians that were surveyed said that they would recommend the profession to others. And I couldn't believe it. I was shocked. I thought, gosh, I've been so passionate about this profession from such a young age. Most of us want to be vets from a very young age. And here we are getting into vet medicine and then suddenly deciding that we don't think it's very good after all. And why is that happening? And, come to delve into this research a bit more and see that a lot of these were younger veterinarians and we speculated that they had a different vision of what they thought vet medicine would be like compared to what the realities were. So, that really started me thinking, I think veterinarians really need to know what they're getting into before they choose this profession, and that veterinary medicine has changed so much from the way it was decades ago and even from the way it was, 5, 10 years ago. And then also around the same time, I was really starting to see this disconnect between clients and veterinary teams, and that disconnect was growing. And there started to be this rift forming amongst some clients that really saw veterinarians or see them as money hungry, and, with the rising cost of pet care, and that it's the veterinarian's fault, and increased complaints and litigation against veterinarians. And then on the flip side, veterinarians and veterinary team members feeling really misunderstood by clients and taken for granted or taken advantage of, and dealing with a lot of disgruntled clients and the challenges with that. And it really more so than ever before felt called to write a book that pet owners would understand and be able to read and recognize really what this profession is about, how wonderful it is, and that there are some really significant challenges that they might not be aware of. And then, of course, to prepare anybody going into the profession, thinking about the profession, working in this profession, to really understand all the different things that we deal with, and just really heighten empathy and compassion on all sides.
Wow, yes, those are some very lofty goals, and I think you've done an incredible job. I've already started going through it, and there's so much here, and just kind of from a writing perspective, I mean, it really is a monumental task to write a book for both veterinary professionals and for sort of the general public, presumably, pet owners, people who have an interest in the veterinary profession but are not a part of it. It's very hard to write for multiple audiences. At least, certainly, that's what I've learned as a writer. But you write in the preface that this book is for everyone who's connected to veterinary medicine. And as I said, that can be a very challenging thing to do. And so, how did you decide to include these multiple audiences in the same book?
Yeah, I really, it's such a great question. And I guess I don't know that I've achieved it yet, but that's certainly been my goal. I wanted to make sure that I included stories that everyone could relate to. And so I have some personal stories about my own life, my own journey in vet medicine, the dogs that I've had along the way, the cases that I have cared for, throughout my career, and stories from others in our profession as well. And so my hope is that those stories really connect with the general pet owning or animal loving audiences. And I think that those stories will resonate with people in our profession too. And supplemented with that, there's a fair amount of research that I wanted to include as well. As somebody who did my training in academia, I was in academia for 5 years as a assistant professor. Research and evidence is very important to me, and so I wanted not just to include stories, but to highlight what the evidence shows. And, I've made it so that, yes, there's research studies that are described in the chapters, and there are also these little facts that people can take away. So little tidbits that might be more accessible to the general public, or to people that don't feel like they need to get heavy into the weeds of what the statistics are, that they can get the big picture takeaways from, what these experiences are and how they dovetail into what the studies or the research shows, and hopefully make it accessible. I think for me, as a longtime reader of nonfiction, I like it when I can read a story or understand a concept and then also see that there's research behind that. There's evidence to show and emphasize what that means. And so I definitely strove to do that with this book, and I was very grateful because I had a lot of pet owning non-veterinary people along the way who were, functioned really as beta readers for me. So they were able to read through the stories and connect with that, or tell me what they didn't connect with. And again, really emphasizing to anybody who is helping me with reading the content early on to make sure that it would connect with somebody who wasn't immersed in veterinary medicine.
Yeah, I love that. I love that idea of just kind of bringing everyone together because, as you said, sort of at the beginning, there can be in a lot of sort of parts of veterinary medicine this big disconnect, whether it's between like pet owners and veterinary team members or even within the profession itself. So having something where we can kind of come together and find our commonality, like you said, around pictures of dogs or stories of of pets and patients. I think that it really is what brings us together and helps us remember why we're here. And I do love you. I'm looking through your book right now. You have these little did you know boxes kind of throughout the chapters where it might be something that either summarizes some statistics or some research, or maybe, as you said, give someone who doesn't have a background in the field a little information that if you didn't kind of clearly explain it to them, they might not be aware of, they might not know. So I agree. It does seem like it's going to be helpful for those who haven't ever worked in veterinary medicine to get a little kind of window into what we do. And is this something that you would recommend that pet owners read so that they can get a better understanding of how challenging our profession is? Is that one of the goals that you had? Is to kind of give those who obviously value veterinary medicine in some degree, but maybe don't realize everything that we're facing and everything that we're dealing with on a daily basis. Do you feel like this will help them get some glimpses of all that we're the work that we're doing behind the scenes and how much we care and how much of a challenge it can really be just kind of working in veterinary medicine on a daily basis?
Yes, absolutely. That is definitely my goal, and I shared the book with a good friend of mine who is a pet owner and also happens to be a nurse and an acupuncturist, and so she's a care provider as well. And she loved it. I've known her since we were in kindergarten, so she already had a little bit of a the scenes look at vet medicine just because we've known each other since we were kids, but it really did open her eyes up to many things that she was never aware of as a pet owner that sees the veterinarian regularly. She has bulldogs. She's always had bulldogs, so you and I both know that they make pretty frequent trips into the clinic, and so she also really, as a care provider, she really appreciated that a lot of the things were similar. Specifically, there's a chapter in the book on the hidden curriculum, and she noted the same thing when she went to nursing school, and just different topics that really connect. And so, yes, my hope is that this gives people a behind the scenes look at what veterinary medicine really is about. I think, you know for those pet owners that love reading nonfiction, they like learning things, they like getting a behind the scenes look at different professions or different topics. This offers that really in depth look of really everything there is to know about vet medicine today, from the mental health challenges of veterinarians to the incredible things that we do in the ICU and among different specialties, to pet health insurance and how that has changed the profession. All of these topics are covered in some way in the book. And so I do hope and believe that it will resonate with the general public.
Yeah, you really do cover so much. I think there are 40 chapters. Is that right?
That's right.
It's very comprehensive, and you divide the book into 4 different parts, that I kinda wanted to talk about, and the first of which is your journey in veterinary medicine and as a critical care specialist, but you really go back, as you mentioned before, you go back to your childhood growing up as a child of 2 vets and, all the influences that you had that fueled your desire to be a veterinarian from a young age. And I'm just wondering what that exercise did for you in terms of going back and revisiting the deep roots that you have for your love of animals and your love and appreciation for veterinary medicine. And if that gave you a deeper appreciation for all the experiences that you've had in the field since then, or if there were any other sort of surprising discoveries or revelations that you had kind of going back down memory lane and just really examining all of your formative experiences.
Yeah, it was fun, and it took a long time, and the book happened in different stages. I had written a proposal for this book before the pandemic. It must have been back in 2018, and had a rough idea of the different topics I wanted to talk about, and my story that I wanted to share. And then, that morphed over the years until I think it was 2019, or maybe even after. I can't recall exactly when the book proposal was accepted. And then I got really granular about what each of the chapters was going to cover, and specifically what stories I wanted to share. And so there was a lot of, looking back through photo albums and looking through, because this was kind of just at the beginning of the digital era. So there wasn't, I didn't have a lot of written files on my computer that I could go back to and look at, but just really thinking through each of these seasons and stages of my life, from pre-vet medicine to veterinary school itself to my internship and my residency, and then working in academia, and then leaving academia and experiencing burnout, and then becoming a mental health advocate. It was funny how the different stories would come back to me at different times, and then I would connect with some people in my life from those different times. I asked my parents some questions about, their experience in vet school, and how they met, and what happened right after they graduated, before I was born. I didn't know exactly, what that looked like for them in their veterinary journey. And then, even reconnecting with resident mates of mine, one of whom is now on faculty at NC State, where I did my residency, because I talk a lot about the residency program at the time and the different challenges. And I know that that residency program has changed. And so it was just, it was really great to go back and connect, and to really kind of close the loop, or come full circle in terms of looking at how things have morphed into what they are today. And again, really hoping that people will see through me sharing my journey, that all the different things that go into becoming a vet, and all the different journeys or paths that a veterinarian can go on with their degree once they have it, that it doesn't necessarily have to be, you graduate, you go into practice, or you graduate and you own a practice. I mean, as you and I both know, as those with non-traditional veterinary careers, it can be many, many different things. So that was important for me to portray as well.
Yeah, I love that because, certainly many of us probably have an idea, and certainly those who are outside of the profession probably have a very limited idea of what it means to be a veterinarian and what veterinarians can do and what veterinarians actually do on a daily basis. And then with time, you begin to see that there's a lot more out there. And there are so many amazing and innovative things that veterinarians are doing and can do with their degrees and their experience.
Absolutely. I think almost every time I share with a layperson or somebody in the general public, a pet owner, that I am a veterinarian, the next question always is, "Where do you practice?"
Where's your
Or "What
practice?
what
Yeah.
practice do you own?" And
Yeah.
it's so much more than that. And I think it's important for them to know that, and for people in our own profession to know that, because I think sometimes people in our profession can feel a little bit pigeonholed as well into, where am I going to practice? Own versus associate, internship versus not. It can feel very binary, or, one or the other, and it's just not black and white.
Yeah, definitely. And sort of after you talk about your own sort of origin story in veterinary medicine, you talk about a lot of the different elements of veterinary training and your veterinary training experience and sort of the things that others may or may not experience, things that we don't always talk about on a regular basis, things like the rejection from vet school, having to apply to multiple schools, or having to apply repeatedly year after year. The mounting student debt is getting more publicity now than perhaps it did in the past. And then you mentioned before the idea of the hidden curriculum, um, sort of the maybe the training that's maybe not explicitly spelled out in the syllabus in terms of what they want you to learn, but the things that you still end up being taught and picking up along the way. Um, and when I read about that part, immediately I thought back to perhaps some of my own experiences, and I interpreted that hidden curriculum idea as, um, kind of being trained and sort of learning to not have boundaries, to always say yes, to always be available, to not have any expectation of having kind of a life outside of vet school, because that's really what I look back now, 20 years ago. And that's how I view sort of that the hidden messages that I feel like I was given during my vet school experience. But then you included some other things like an expectation to party on the weekends, an expectation that perhaps quote unquote everyone, I'm sure it wasn't everyone, was cheating at one point or another.
Mhm.
And that students were being discouraged from asking a lot of questions during their rotations or showing emotional reactions related to their cases. And I think that's so interesting that um, different people can experience different sort of hidden messages, hidden lessons in their time in their training. So I mean, I guess it does really depend on where they went to school and when they went to school and who their mentors are and all that kind of thing. But I wanted to ask you, like, do you think even now that we have a lot more awareness? I mean, again, we have this term, we know that it's something that may be happening. Um, and we talk a lot more about things like quality of life and boundaries and work-life balance and all those kinds of things. Do you still feel like in some regard there's still some kind of hidden curriculum that students are learning and absorbing maybe without even realizing it?
I do. I think as you said, we're talking about it more today than we ever did before. I think it was certainly a newer term to me a few years ago, but I'm glad to hear that many people do understand what that means when we talk about the hidden curriculum. And I love the examples that you raised. And it wasn't until I thought about it more and actually I asked some of my vet school classmates and others in this profession what they considered to be part of the hidden curriculum. And they were the ones that brought up, like, well, you're expected to get high grades, but then you're also expected to like drink on the weekends and like, be, this party animal or whatever. So a lot of those experiences were those of others. I think one of the areas where I see the hidden curriculum still come into play, and it's similar to what you alluded to, and I guess it's for me, it's through the lens of a mental health advocate, where you would think in this day and age where we talk more about mental health than we ever have before, that individuals would feel comfortable taking a leave for a mental health concern or taking a sick day or a mental health day when they need it, or asking for time off to go to a mental health appointment. And yet it still seems that when we survey veterinary students within the scope of mental health stigma, that the stigma is still really persistent. And if you read the open text responses from veterinary students, they still are saying things like, I would be regarded as lazy, or I'm just expected to put my head down and get through it, or, various other renditions of that. And that all for me is part of the hidden curriculum. That is all this cultural expectation that vet med is hard. It's going to be hard. You're probably going to burn out and you just got to get through it. And that's not what we want, right? The whole goal of talking about the hidden curriculum is to really shorten or shorten is not the right word, but diminish this gap between the things that we are teaching with our words and what students are seeing with our actions. And so it's one thing for us to say your mental health is important. Um, it's important for you to be compassionate with your clients and so on. And then on the other hand, not talking about mental health or not giving people the space to have mental health challenges. Or when somebody does show emotion with their cases, which was my personal experience, that they're not, told to stuff those emotions down. So it really is a fascinating topic, and I'll be interested to hear what other people's experiences are or thoughts are when they read it. But yes, I would say that we do, while it has changed and it has improved, I do still think that there is some component that may always be there, and maybe that's just a part of the way, just academia. We have the ideal that we want to teach, and then we have the reality that is what people see when they're in the clinics and really getting into the work itself.
Looking for the latest veterinary news? Stay ahead of the curve with stories from the American Animal Hospital Association's digital, award winning newsroom, Trends. We're bringing you fresh stories every day, covering everything from the cutting edge clinical insights to helpful practice management tips. And it's not just articles. Watch videos, check out interactive charts, and learn more about the people shaping our industry. As an AHA member, you also unlock exclusive members only content designed to help you and your team thrive. Visit aha.org/trends today and sign up for Trendsetter, our newsletter where all of our stories are delivered to your inbox twice a week.
I would be really interested to kind of hear what kind of feedback and what kind of, conversations spark from others reading this book and looking back on their own experiences, whether they are really recent or from many years ago, and sort of seeing how that narrative has changed over time. Um, but like I said, I'm sure there will always be something, the messages that we sort of take away from our own experience and the way that we interpret what others are doing as we move through life, that'll never go away. But I'm glad that you bring up the mental health piece, because I think that is so important for others to really understand and feel that it is okay for them to talk about their own mental health experiences and to get help and step away, as you said, if needed, if that's what the circumstance warrants. So thank you for bringing up that point.
Yeah,
And
absolutely.
another kind of related topic in your section on, what we understand now about veterinarians that really kind of stood out to me, was this idea that still so many veterinarians attach so much of their identity to their role as a veterinarian, whether it's their particular job or career that they're in, or just their sort of that title as a veterinarian. And you've done a lot of coaching and advocacy work to support the wellness of veterinary professionals. And I was just wondering if you could speak on what you consider to be the fallout or the ramifications or the sequelae, if you will, of placing so much weight on our roles as veterinarians, and often sort of attaching so much of our identity in terms of who we see ourselves as, to those roles, particularly when we face so many challenges in the profession, and it's not always possible for us to feel like we're perhaps as successful as we would like to be.
Yeah, this is a topic of pure passion for me. I really have always been fascinated by the concept of identity and how we see ourselves professionally and personally. And I saw this with my mom growing up. She really, her whole life was vet medicine. She always knew she wanted to be a vet. She was one of only 2 women in her vet school class. Graduated, opened a practice, was a practice owner for more than 40 years. And, she had a really hard time retiring and doing other things because this had become her entire life. And I think we get into this space of who are we if we are not a veterinarian? Many of us, when we are asked, to, tell me a little bit about yourself. I'm a veterinarian is like the first thing that comes out of our mouth. And we don't say, I have a degree in veterinary medicine. We say, I'm a veterinarian. It very much is an identity rather than a degree that we earned that is a gateway for many different identities. And so, I've seen it, like I said, in my mom close to retirement. Certainly when I was at the Ontario Veterinary College, worked with a very renowned criticalist who also was moving into retirement and having a really hard time stepping away from the clinic and stepping away from her role. And I thought to myself, my goodness, what's happening here? And isn't I thought retirement was supposed to be exciting and this is what you've worked your whole life for. But then you can see when that is really everything that you identify with or how you see yourself, that there can feel like an emptiness or a loss or, a fear around who am I without this? And I first experienced this when I left academia. I was at the Ontario Vet College for 5 years, loved the job, it was like my dream job, research, teaching, clinics. I just loved it. And I loved it so much. It was all I was doing. And I got really burnt out. And it was my entire identity. And then it just got to the point where it didn't feel sustainable from a mental and physical health standpoint. And then I really struggled because I had this almost like existential moment of who am I if I'm not assistant professor at this vet school? Like do I go to another vet school and then which vet school do I go to? Like I couldn't see outside of that particular identity and it took a lot of people, coaches, friends outside of the profession to really kind of say to me, Marie, like there's so many things that you can do in your life. Like it doesn't have to be teaching in a veterinary teaching hospital. It could be many things. And so honestly, I think it took me 10 years to really wrap my head around that. And now I've just embraced my multi-passionate personality and my, changing of my projects and roles and things that I do. And I've just really embraced the fact that I have I can identify as many different things: an entrepreneur, a business owner, an advocate, an author, yes, a veterinarian, sometimes an emergency veterinarian, sometimes a critical care specialist. There's all of these different things. And what we know based on the research is when you can have a more flexible identity, that really is a boost for your well-being because you don't feel so pigeonholed when things aren't going well. And there's research actually in vet medicine to demonstrate that when you feel like there isn't another path for you in our profession, you feel stuck, that can really have negative impacts on your mental health. And so, we would love, and this work is being done at the vet school level to cultivate those healthy identities where veterinarians recognize that yes, I have this veterinary degree, and with that degree there are a multitude of things that I can do, that I am trained as a veterinarian and, this is what I do, versus I am a veterinarian and this is what that looks like. I was fascinated too to read about some of the research being done among vet students where even looking at the veterinary identity and recognizing that veterinarians if we consider the healthiest perspective, that if they can consider themselves problem solvers rather than test and, diagnose and treat, then that is going to be healthier for them because so much of our days are not just diagnose and treat. They are, counseling clients, they're dealing with coworkers, they're figuring out a difficult case. Like it is not cut and dry. And so if you can really embrace that identity of problem solver, a more broad-based role rather than a diagnostician and surgeon, then the research really demonstrates better well-being, and that's something I think that we can all benefit from.
Yeah, that's interesting. That little tweak in sort of the way you think about it can sometimes make a big difference. Yeah, but I think that's just a good reminder to all of us that we are more than not that I want to say just a veterinarian or just a part of veterinary medicine, but that's not the only part of us that we have to offer to the world or that we should embrace and nurture throughout our lives. Um, and I another topic that I saw mentioned in your book that really I don't know why it surprised me. Kind of made me sad, but it did. It was in the last section of your book, the fourth section of your book where you talked about the future of veterinary medicine. I had a really hard time picking something to ask you about here because there were so many. Every topic was so timely and so important and so relevant and so interesting to me that I had a hard time really deciding on one. But I did see some statistics there that I wanted to ask you about. So it was in the chapter on DEI, and you wrote about equal pay. And the statistics that you gave, you said that female veterinary specialists in private practice make 25 to 29% less than their male counterparts, and female veterinarians in academia make 8 to 10% less than their male colleagues. And I know this probably shouldn't surprise me because certainly the gender pay gap is a real thing that's been documented for years and years in many, many industries. But somehow I led myself to believe that because a lot of veterinarians are paid on production or have some kind of pay model that goes along with, the revenue that they bring in. I know that wouldn't necessarily apply in academia, but that somehow that kind of reduced that sort of discrepancy because they really were being paid for the work that they do or, the hours that they work and that kind of thing. But it appears to that kind of gender pay gap is more prevalent in our industry than perhaps I realized. Um, and since we are so strongly female dominated in terms of at least entering members of the profession, and have been that way for many years now, uh, what is your take on this? And is there anything that you think of that's specific to the way that we're paid or anything specific to veterinary medicine that you think that's important to consider as we try to work to close this wage gap?
Yeah, I think as with anything, the awareness of the disparity is the first step. And I too was very surprised by these numbers. I knew there was a difference, and I share a story of my own experiences with this. When I was offered my job at the Ontario Vet College, there was a male colleague who had also just finished his residency and was offered the role and was offered a higher salary than me. And, I think the argument in that situation was, well, he has the equivalent of a master's degree in addition to his residency program. I mean, the flip side was that, I had more published papers and more research experience than him. And so either way, at the end of the day, it was equal capabilities in this role and yet not an equal salary that was offered. And so, having experienced that, I knew there was a difference and I couldn't believe the difference among specialties. Um, and then I spoke to some of my female colleagues in practice, and sure enough, yes, they're paid on production, but for whatever reason, their male colleagues have been offered higher production percentages or base salaries or whatever the breakdown was than they had been. And this was a very real concern. I don't know what the ultimate solution is other than talking about it more. I think, you and I certainly have had conversations as well about advocating for ourselves. So I think, eh, I don't know, I think women, especially, those of us that are moms, we've sort of internalized this perception that we can never put in as much as our male counterparts because we are, doing more of the, lion's share of the parenting on the side. And so maybe there's this, you know, just unconscious feeling that, well, it makes sense that a man would be paid more, and I think we need to put those thoughts to the side. I think we really need to stand in what we deserve. I think there's so many different studies that go into how women negotiate, how women value themselves, even research looking at women applying for jobs and how women almost never apply for a job unless they meet all the criteria, and yet men apply for jobs recognizing full well that they don't meet half the criteria for the job. And so I think there's just a lot of deep rooted sentiments that probably aren't even related to vet medicine, but just women in the workforce. And, we need to work as women on correcting some of those mindsets and, training ourselves in negotiation and asking for more. And, I think that the industry needs to do better in terms of making sure that they're really aiming for equity as well, or at least equality when it comes to pay.
Yeah, I definitely agree with that, and, definitely echo that sentiment. I think there are certainly things the individual can do, but it's also on, the part of the system that allows that inequity to be created in the first place and to flourish. And I also wanted to call out, I meant to before when I was asking the question, and you do point this out in your book, that there are other intersectionalities that affect wage gaps beyond gender, so race, ethnicity, and other factors that can complicate um, wage and increase wage disparities even more. Unfortunately, it shouldn't be that way, but just wanted to make sure that call that out, that it is
100%.
still something that we struggle with as a society in general, and unfortunately, that includes veterinary medicine. So I just want to say thank you for calling that out, because I think this is the first time I've seen real numbers that are specific to our profession, and I think that is the first step, is really calling it out, putting it out in the air for everyone to see, and continuing to talk about it so that we are all forced to sort of reconcile with it and decide if we're okay with it or not, and what we're going to do about it. So um, I appreciate that. Um, and and again, we could go on and on because there's so much in your book. It's really such an amazing. I certainly haven't been able to read it from cover to cover yet, but I'm looking forward to delving into it more. And I'm really excited to hear what others have to say about it as things go along. I know you're really out there, kind of hitting the pavement, talking about it, and so I'm just so excited to hear. Um, and to see this in on the shelves and on the desks of other veterinary professionals and pet owners and others who are interested in learning more about our profession, because I'm very proud of our profession, and I can tell by this book that you are too. So I think it's great that you're getting the word out to more people. And I wanted to ask you, just in terms of veterinary medicine, what is one thing I always like to ask, kind of what's one thing that you're really excited about in our profession? Something that's going on now, something that you're looking forward to in the future?
Yeah, absolutely. I mean, I think for me, it's the technology that we've been embracing over the last few years. I have a chapter on technology in the book, and I talk about growing up in the days of the Rolodex, where all of our clients were in the paper files and the paper scheduling book and the credit card machine that wasn't actually a machine. It was like a imprinting device, and how far we've come. And as a practicing clinician, especially in the emergency room where it's high volume, high stress, multi managing many different cases at once, for me, using software that allows me to capture and transcribe the communications I have with clients, and then AI's integration to help me create a medical record, and then to then take that and make it into a discharge summary and everything else. It has just been such a game changer for me as a clinician. And then even as a mental health advocate, learning about all of these new tools and technologies that are integrating AI and using them as, bot features so that you can have these apps if you are living with depression or anxiety, where it can feel like you're talking to a mental health professional and they're connecting with you in real time at any time of day, and that there's research to demonstrate the benefits of that as far as diminishing symptoms of depression and anxiety. So, I mean, there's intersection there between the challenges that we experience in vet medicine with mental health. And I'm just excited for it all. I love that we are embracing some of these technologies, that we are utilizing them for better and quicker diagnostics and more accurate care for pet owners and their furry family members. So I can't wait to see where things go from that perspective.
It is very exciting. Yeah, I can't even keep up with everything that's out there now, but yes, I'm anything that helps us do our work better, more efficiently, with less stress, um, I'm here for it. Love it. Well, thank you so much for spending this time with me and for sharing all of these little insights on your book. I really appreciate it. I'm looking forward to others finding out about it and getting their own copy. Just wanted to ask you if you have any final thoughts you would like to share with our audience, or if you'd like to let others know where they can find you and follow you if they're interested.
For sure. No, this has been such a pleasure. I thank you so much, Emily, and I really can't wait for people to get the book and, to share it, maybe have a copy of it in the exam room for your clients or, share it with your clients, read it as a team. If you go to a compassionatecalling.com, I talk more about the book there. And I also have some resources. So there, if you choose to, read it as a book club within your team, then there's questions that you can utilize. There's questions too for pet owners who want to do it with their own book club. And there's even some handouts that we can share with pet owners. The handout is 10 things your veterinarian wishes you knew. So you can visit the website, find out more about the book, and you can also certainly connect with me. I'm quite active on social media, Marie Holowaychuk or Dr. Marie Holowaychuk, and just super happy to connect. And I can't wait to hear what people think.
Awesome. Thank you so much, Marie.
Oh, thank you. It's been a pleasure.